My name is Professor Sheila Tlou. I'm the co-chair of the Now Global Campaign. I'm also former Minister of Health of Botswana and former UNA's Regional Director for Eastern and Southern Africa. But my main heart is with nursing, so I'm proud to be a member of the Now Global Campaign. I started realizing that I'm interested in nursing. I would say when I look at myself, I would say it was probably from early. In terms of doing for other people, that's really the spirit that made me go into nursing, to say, look, I am able to advocate, and I think I can even advocate for patients, especially at community level, because I've always figured a lot of problems then start at community level. Yes. I would say my inspiration to become a nurse leader was my own mother, in the sense that when I grew up, she was a hospital administrator. So we used to go over and see what she was doing, an administrator in the hospital, and therefore working with nurses and doctors. But then her friend, who was a nurse, also inspired me. But I must say that later, as I was now a young nurse, I was now being inspired by nurses who were making it in the world, in Botswana. For example, our very first nurse, who we call our own Florence Nightingale, Professor Tlou, she started professional nursing. And nursing was then started at the Institute of Health Sciences. But later we had a degree nursing program at the University of Botswana, at which I taught. But she was one of the people who really inspired me. To become a nurse, one of the qualities, a lot of qualities are needed, but I think the first and foremost is really self-introspection and knowing yourself, knowing how you react in different situations, and really saying, what kind of world would I want, and how do I therefore participate in making that world real. We need people who are assertive, who don't have to ask permission to do a lot of things, especially when you know they are right. And half the time, the curriculum doesn't put that part in. But assertiveness, knowing your knowledge, knowing your rights, and other people's rights, are really great qualities in nursing. My dream, I've already been a Minister of Health, but my dream is to one day see a nurse who is president of a country. And I really think that country will be so well run, because it will take that holistic approach as to how people should be alive and how people should be well, and really look at the well-being of everybody. Nursing Now, which is really the global campaign, is really saying beyond the 21st century, we will not be able to achieve universal health coverage unless nurses are involved in decision making, nurses are involved in all aspects of health as leaders. So I believe that this campaign, Nursing Now, will really be the one that will propel our nurses to be the leaders that we would want them to be, to ensure that they work with communities, they work with all what we call marginalized populations, populations that have been left behind, such as people living with disabilities, people in prisons. We need nurses who can do that. And I know that the Nursing Now campaign is that holistic, is that comprehensive, that it can be able to assist our nurses to be able to lead.